talk about GreenLight Laser. Let me start with an explanation of what happens with the prostate. The way the urinary system is put together, the kidneys make urine. Urine runs through tubes down to the bladder. The bladder has to store urine until full, then empty road to the outside. First part of that road is the prostate. When men are 20, the road is open, and by the time they're 40, the prostate can enlarge and begin to block the road. As the prostate blocks the road and causes urinary bother, we use the different treatments available to see if we can lessen the burden for men. We try the different pills first, but for many men, pills are not enough. They don't provide enough benefit. When drugs aren't the answer, then there's different techniques available, one of the most favorable of which is the GreenLight Laser. The idea of the GreenLight Laser is we can look up the urinary pathway and then use the laser to melt back the blocking parts of the prostate to open the pathway back up. So to use a metaphor, to plow the road open. It's done as an outpatient. The men are put to sleep for it. They come in, they get it done, they go home the same day. They have a catheter or tube in the penis that stays in for a couple days, which is then removed. And then the men can resume their normal activity once they get back home. It takes the first several weeks for the construction dust to settle, but long term, the men notice that once the blocking part of the prostate has been removed, they have better force urination, a better sense of empty, and over time, less of that frequency and urgency. So a common procedure, one that we're happy to offer to men, recognizing it can help lessen the burden that goes along with all the urinary bother that goes along with the enlarged prostate.